Hello, I'm Dr. Neil Schultz, and welcome to DermTV. Fillers like collagen and Restylane and Juvederm are very common and very popular for correcting lines and wrinkles, some scars, creases, and lots of other contour problems. But to determine whether filler treatments are right for you, just like any other procedure, you need to know what are the advantages and what are the disadvantages, what are the pros and cons. So let me tell you. There are many advantages to fillers. First of all, they're fast. Treatment can take 5 minutes or 15 minutes, maximum a half an hour. You're in and out of the office. Second, they're relatively inexpensive for cosmetic procedures compared to any type of cosmetic surgery. Third, there's no general anesthesia, so you don't have to be concerned about side effects from general anesthesia. Fourth, because many of the fillers are not permanent, if you're unhappy with the results you have, you don't have to live with it for the rest of your life. It'll wear off over a period of a couple of months. Next, there's just not that much pain involved with the injection of fillers, particularly with the new topical anesthetics that we have that diminish discomfort, and also some of the newer fillers actually have anesthesia added right inside the filler material, so that makes it less uncomfortable. And last, there's very little downtime from filler treatments, and usually you can go right back to work. You may want to put a little makeup on, but usually you can go right back to whatever you were doing in life. In terms of disadvantages, well, there's been a lot of advances in decreasing the discomfort, but there is still some pain involved in filler treatments, and that's very personal as to how you judge the severity of that pain. Because most of these are not permanent, you do have to have repeat treatments, somewhere between 3 and 9 or 12 months later, so it's an ongoing treatment, which of course involves ongoing cost. In rare occasions, there can be allergic reactions, which results in red bumps at the location of the filler. That goes away after a couple of months, but that's annoying. And you can get bruising as a result of the injections, and that's not a function of the technique of your doctor. It's because the filler injections go deep, and you just can't tell if there are any blood vessels there. But last and most important, there are just certain limitations to what fillers can do. Because fillers restore lost volume, but they don't restore lost elasticity. So as your skin continues to sag, there's a certain point when fillers just don't do enough for you, and if you want that corrected, then you do have to have cosmetic surgery. So those are the pros and cons of fillers to help you decide, are filler treatments right for you? Please join me again at dermtv.com. If you have a question, please send it to me by visiting dermtv.com/question. I'm Dr. Neil Schultz, and thank you for watching today.